Welcome, everyone, and thank you for joining us today for a dynamic conversation on accelerating the next generation of climate policy and human health. My name is Linda Henry, and I will be your guide through this action-packed hour. Let's dive right in. We know that the climate crisis is an environmental and health crisis. One of the many problems created by climate change is air quality. Air pollution, mainly caused by fossil fuel emissions, impacts human health. The award-winning newsrooms of the Boston Globe and Stat News, our life sciences publication, have been reporting on the ways that COVID-19 has spotlighted dramatic health disparities in our state. We have also covered the role that air pollution has played in compounding COVID-19's health risks. But the overall role of environmental pollution on human health has not been the media's main focus when covering climate policy. Climate change is a health crisis that impacts everyone, but like this pandemic, impacts vulnerable populations most of all. Massachusetts has taken bold steps on a path towards helping with this by setting a net zero carbon emissions goal by 2050, but more needs to be done and fast. Massachusetts can build on the remarkable research foundations and forward-looking policies that exist here to affect real action within the state. At the same time, we're showing a model of innovation and leadership that can be used throughout the country to address climate change with clear considerations around health for all populations. Today, we will talk with Michelle Venatos, the CEO of Biogen. Biogen has recently made a really big commitment to eliminate fossil fuels from their operations. Michelle will be followed by a fantastic panel of experts that I'm so excited about to talk about the health implications of climate change. We'll also look at what actions government, private, and nonprofit organizations are taking to affect real action in the state and beyond. First, we have a special welcome message from Massachusetts Governor Charlie Baker.
This is Massachusetts Governor Charlie Baker. I want to thank Boston Globe, Biogen, and all the other partners who are hosting this important conversation on climate change. Climate change is a health crisis. The effects of climate change, lower air quality due to pollution, stronger storms that disrupt our communities, all have health impacts too. The urgency of our response must match the urgency of the problem. The scientific consensus has shown us that we must act quickly, and Massachusetts has a responsibility to model innovative climate solutions. The COVID-19 pandemic has underscored how a health crisis can disproportionately impact vulnerable communities. Throughout this pandemic, we've prioritized helping cities and towns with large communities of color and gateway cities who've borne the brunt of the impact. We're taking the same approach to combating climate change. For example, we're helping all our communities invest in climate resiliency through our Municipal Vulnerability Preparedness Program. We recently announced that the MVP program, which is voluntary, has reached 90% participation among Massachusetts communities, with 312 of our 351 cities and towns participating. Since launching the program, we've invested over $44 million in climate change resilience and hazard mitigation projects around Massachusetts. Additionally, earlier this year, our administration announced that we're committing the Commonwealth to achieving an ambitious climate goal, net zero greenhouse gas emissions by 2050. To help achieve this goal, we're proud to support a regional transportation climate initiative, a collaboration with other Northeast states to reduce transportation emissions while garnering revenue to invest in a more accessible, low-carbon system. Tackling transportation emissions will be crucial to mitigating the health impacts of climate change. The COVID-19 pandemic has underscored the connections between environmental health and human health in cities and towns across Massachusetts. Communities with the highest percentage of Black, Brown, and immigrant residents, including Chelsea, Everett, Brockton, Lawrence, and Lynn, are so-called high-risk communities for COVID-19. These communities are also confronting environmental challenges around issues like air quality, stormwater runoff, and other issues associated with climate change, and they remain among the most vulnerable. By working to reduce emissions and pursue a clean energy future, we can battle the environmental burdens placed on these communities, and we're committed to working with partners in the advocacy, healthcare, business, and legislative communities to make it happen. Today, you've gathered leaders in all of these areas, and I'm also proud that you'll be joined by our Secretary of Energy and Environmental Affairs, Katie Theoharides, who will talk about some of the work that's currently underway here in Massachusetts. I want to thank you for your leadership, and we look forward to continuing the conversation and to driving tangible progress across Massachusetts, this region, and beyond. Because together, we believe we can be a model on climate change and healthcare for all.
Thank you, Governor. We're going to start off now with Michelle Venatos, the CEO of Biogen. Biogen is headquartered right here in Cambridge, Massachusetts, and is one of the largest biotechnologies with over 7,400 employees worldwide. Last week, Michelle announced a $250 million initiative to eliminate fossil fuels from Biogen's global operations by 2040. So they're stepping out in front of Massachusetts, and also committed to investing in research on air pollutants. This is a really groundbreaking commitment and puts Biogen as the first Fortune 500 company to commit to this fossil fuel-free goal. Michelle, thank you so much for joining us today, and congratulations on your Healthy Climate, Healthy Lives announcements last week. And thank you so much for your leadership here.
Thank you so much, and I'm the one to thank Governor Baker for his leadership of the state and the ambitious pledges and objectives that he's setting in terms of climate, but also the transport climate initiative that is important for the community. I also want to thank Linda Henry and the Boston Globe for hosting us, and I am honored to be part of such an impressive panel. Climate, health, and equity are intertwined. And very unfortunately, we are not tracking well as a world. We are missing every single year's target. And as a consequences, this is pretty stunning. This is claiming approximately 9 million lives a year, which is really incredible. If we were to eliminate the fossil fuel from the environment, life expectancy could increase by more than a year. So it's very urgent to act, and time is now. This is a time where we need leadership. Biogen has had a long history of climate responsibility. And the aim is to move away from the paradox of having the objective to save lives as a company, but at the same time contribute to the pollution that impacts mortality. So we have been carbon neutral since 2014, but as well documented in the literature, this is not enough. So the next level of ambition is our Healthy Climate, Healthy Lives pledge of being fossil fuel free by 2040, investing $250 million on top of what we have already done in three main directions. The first one is somehow reinvent the way we operate, from clinical research, from early research, from also all the fleet that we have, and the commercial and the biomanufacturing. And this is the first pillar. The second one is to engage with a very large employee base, with an employee resource network. We'll come back to that, hopefully. And the third aspect, which is critical, which is to partner with renowned institutions like the MIT and Harvard. The world has to take those issues head on. Transportation, waste management, agriculture, and many more topics. But we don't have time to wait for technology to develop. We need to get started now, and every single effort counts.
And so you mentioned what I love about this is that there are these three components, and you mentioned the research aspect, that you're investing in sort of everybody understanding this going forward. What areas of research are you most interested in?
Well, we are partnering with the MIT and Harvard in order to define targets, health targets. When we speak about the reset, the big reset of the economy, very often we speak about GDP, employment, and many more economical factors. But do we have the right targets that can be measured in terms of progress against, in terms of climate changes? I'm not sure. We are also investigating the correlation between climate change and the pollution and brain health, which is at the heart of what we do. We are specialized in neurology, as we know, neurodegenerative disease. So these are some top priorities.
Mm. And this era of, we call it, stakeholder capitalism, the spotlight on employees is really important. And this was another aspect of your initiative that was really impressive, is that you're really engaging the employees of Biogen and sort of having a part in this healthy climate, healthy lives. What does it mean to them? How are you engaging your 7,400 employees?
Certainly, Linda, and this is at the heart of what we do. The people always are the most important assets that we have. And we care deeply in our DNA. And climate, health, and equity is at the top of the list of their concern. So we need to be creative. We need to innovate beyond the bench of the labs. And our 8,000 or so employee base worldwide, or the 3,000 in Massachusetts, need to take the lead in order to find small wins and deliver on those. And we have many examples. One of them in our biomanufacturing unit at RTP in North Carolina, a professional changed the manufacturing process and was able to eliminate 2,600 pounds of this nasty pollution. Or in Massachusetts, in terms of facility team management, by saving on energy, we save the equivalent of 200 homes being heated. So we need to pull the sleeves and call for every creativity and incremental steps that we are celebrating in order to contribute to what should be a global effort of the public sector, but also the private sector.
Great. And this is where you're also engaging, you're changing the vehicles that your company uses as well. That's also impacting your employees.
Yes, certainly.
Given the global pandemic's disproportionate impact on vulnerable populations, this is something we're going to be talking about more in the panel. What is Biogen, as a company, you're at the forefront of medicine and innovation. What have you learned about climate and public health this year?
So, as you know, very unfortunately, we've had a unique experience. We were hit hard and very early in our hometown by the COVID pandemic, and this has been a shock, and this was very unfortunate, very early before any clear guidance were emitted. So the company is absolutely committed to advance science and knowledge in that space. What the pandemic highlights all around the world is the dramatic health disparity and calls for additional enhanced focus on the interrelation between climate, health, and equity. I was reading this weekend a latest publication from the Lancet of this past July. And previously there were, and as you know, we are specialized in neuroscience and we are very passionate about also Alzheimer's disease and dementia. There were 9 well-documented risk factors for dementia. And in this article, they said actually there were 12. And they add 3 of them. And one of those is basically climate change. Wow. And those can explain 40% of dementias. So it means that we could eventually prevent if we're able to work on those risk factors that include hypertension, obesity, sedentarity, and more, and also climate change. So, and very unfortunately, the impact of this pollution that is very well correlated to this neurodegeneration now and well documented in the literature, is impacting the socially, underserved population. So, another reason to act.
Wow. My final question for you is Massachusetts, your target, you're headquartered here, you're definitely a global company, and you yourself are about one of the most global CEOs. You've lived all over and you speak 6 languages and you really take a global approach to your leadership. But what role can Boston play as a leader of science, technology, and medicine to help solve this issue for the nation and the world? What opportunity do we have here?
Listen, pandemias has no border, and science and innovation has also no border. I think that Massachusetts has a baseline of accomplishment that is remarkable, being in terms of energy efficiency for the 9th time in a row, the #1 state, So fantastic. And Boston in 2019 being nominated as the first city in the world again for energy efficiency. So it's a testament for the leadership of Governor Baker, but also Mayor Walsh. I applaud that. I also applaud the work that our industry group are leading, mass bio, and also in the healthcare sectors. Blue Cross Blue Shield, Mass General Hospitals, Boston Medical Centers, and many more. We are so proud about Boston. Boston, I used to say, is the global headquarters of innovation. We have the leading institutions, schools, talents. We have the best policymakers. If we were able to bring those together, we'll be able to build further a center of excellence that could be a benchmark for the world on those topics.
That is incredibly exciting and really inspiring. Michelle, thank you so much for your leadership here and good luck. I could talk to you for an hour on all these things that you're doing, but we have a really, really great panel. So thank you. And I really hope that your climate actions inspire others to follow suit. Thank you.
Thank you, Linda.
I'm going to now invite our fantastic panel to the screen to continue this conversation. I'll introduce them one by one, and then I'll go through and have a conversation with each one. Our first panelist is Dr. Aaron Bernstein, who insists that I call him Ari. He's the director of Sea Change at Harvard. We have Eugenia Gibbons, who's the director of Healthcare Without Harm. Kate Walsh, who is the president and CEO of Boston Medical Center. Elizabeth Turnbull Henry, who is the president of the Environmental League of Massachusetts. Mindy Luber, CEO and president of CERIS. And Kate Theoharides, who is the Secretary of the Environment of the Commonwealth of Massachusetts. Thank you guys all so much for joining today. And Ari, I would like to start with you and your specific expertise and how do you see climate and fossil fuels impacting human health?
Well, thanks for that question, Linda, and it's a real honor to be on this panel and hear really inspiring words from Michelle and Governor Baker to lead us off. And, you know, I do really think, and I would agree that we are uniquely poised to contribute disproportionately to solving not just the climate crisis in this state, but to advancing solutions that I would argue are climate solutions, health solutions. As you heard, climate change is a major factor to health for everybody, but particularly those who have been left behind. And so we also have, with the same solution set, equity solutions. I think about the children I care for. I'm a pediatrician at Boston Children's, and I've seen children with COVID. And a lot of those children are the same children I would see otherwise for asthma. They're children who have not been as well off as other children in our community. They are the same children who may have to breathe more air pollution. You heard about Governor Baker being a champion of the TCI. We've been working on the health analysis of TCI because the transportation emissions are disproportionately affecting populations that are often less well off, often have health burdens that are higher. And so you can see very quickly how pollution ties together equity issues. We know that that pollution is coming from burning fossil fuels out of cars and trucks and power plants. So it also reduces greenhouse gas emissions. And if you stop burning those things, you can actually prevent cases of asthma. You might even prevent COVID. There's some evidence, including from colleagues of mine at the Chan School, suggesting that air pollution is a risk factor for dying of the disease. And so I think we really face two challenges now with addressing the climate crisis. The first is really a challenge of making the issue personal and bringing it down to size. We have to make climate change an issue that matters to people in their day-to-day lives, and the pollution issue is the clearest way to do that. We have to make it about health because the evidence tells us that when you start talking about climate change as a personal health issue, as an issue that matters to my ability to do my job as a doctor in healthcare. I mean, in Louisiana right now, in Lake Charles, the only hospital serving that community is not working because they have no safe drinking water, potentially for a month, because Hurricane Laura knocked out their water treatment supply. So it's a real issue for care delivery. And I should mention that we are going to be working on trying to advance solutions to make the clinics around the country that are most at risk from climate change, and frontline clinics that are serving some of the populations that are rural, harder to get to, have less access, more resilient. If we make these issues about climate change more personal, we transcend politics and we can make them actionable. I think that's our biggest challenge right now. And the second thing is we have to show how climate actions promote health. We spend too much time talking about climate change as we've gotten to the point where we're talking about climate change as a health challenge, which I think is a major advance. But we need to start showing how actions that we take are climate solutions. They are health solutions. They will prevent diseases, whether that's, as we heard about some of the brain diseases, they're very common in society, children with asthma, maybe even prevent diseases like COVID from being more lethal. And we have to show those gains and how they potentially can help us provide more to the communities that have been most affected historically. And so I'm really optimistic that whether it's through the TCI, whether it's through the work we're doing with Biogen on addressing frontline health clinics, whether it's through the actions you'll hear about from my fellow panelists that they're doing their work, we're showing how these solutions to climate change are equity solutions, are potentially pandemic prevention solutions, and are frankly things we should be doing to protect our health right now anyway, regardless of these other crises. So that's, I think, real cause for optimism. And I'm hopeful that with this conversations and others that we're hearing in Climate Week, this message is going to become ever more clear and important.
I really like your positioning on this. And we were actually talking about how there are a lot of really local issues that come up on a regular basis that highlight this. And on Friday, we were talking about the tree cutting on Melnea Cass Boulevard and what that is. Can you talk about the context around that?
Yeah, it's really good to make these things local and concrete. So Melnea Cass was built on the rubble of a community that had been displaced for the inner belt highway system. For those of you who know Boston's history, there was a plan to build a major highway through some of the poorest parts of Boston, and that particular part was bulldozed. The highway never got built, at least where it was planned. And so Melnea Cass was built, and there is green space around it. There are mature trees in one of the biggest heat islands in the city. Now, Chelsea is the hottest heat place in this Boston because has the least amount of green space, the most amount of dark surface. We also know that Chelsea is a major place for COVID in Boston. We also know that Chelsea is exposed to more air pollution. Again, you see these overlying circles. So the idea in Melnea Cass to take out trees to make more room for cars, in my view, is running the wrong direction. It's running away from the challenge in front of us, which is to promote equity. We have another choice we can make in Melnea Cass, which is we can plant more trees and we can find ways to get people to where they need to go with fewer cars, or at least cars, hopefully, that make less air pollution. And so why not provide for more green space without sacrificing the trees that have provided at least some shade, and trees, of course, also promote air pollution reductions. But that's just one example. We have many such instances. And I think the challenge is, trees don't grow overnight. This requires long-term planning. And we know that, the heat islands in the city, again, are most often in places where communities are poor. They may be more subject to air pollution. And right now they're facing coronavirus.
Thank you, Ari, and thank you for really making that concrete connection to us where the environment, you see having a direct local impact on children's health specifically. Even within a short area, there can be a vast difference in the asthma rates, for example, of children based on how clean the air is in their city by city, even though it could be a mile and a half apart. Yeah. Eugenia, I'm going to go to you next. Ari was talking really specifically about children, which is a really important thing for us to focus in on. But I'd love for you to zoom us out for a minute. The healthcare sector is a major employer in Massachusetts and a source of global growth. What impact does this sector have on climate?
Sure. And first of all, thank you so much for the question, Linda. And like Ari, I'm really thrilled to be here today with all of you. So the healthcare sector is one of the largest in the world, and it faces the challenge of both recognizing that it has an impact on climate, that its practitioners like Dr. Bernstein are confronting daily the health effects of climate change caused by fossil fuel consumption, but then they're also contributing significantly to the issue that they're treating because they're a highly energy intensive sector. So in September of 2019, Healthcare Without Harm, which is the organization I represent, in partnership with ARIP, actually released a study that looked at healthcare's climate footprint globally. And it is a major emitter, as you noted. Globally, the sector accounts for about 4.4% of global net emissions, which is roughly the equivalent of 514 coal-fired power plants. If the sector, to put it into perspective, if the sector were its own country, it'd be the 5th largest emitter in the world. So it has a huge impact. And within that space, it shouldn't come as a surprise that the United States healthcare sector is actually the #1 global emitter in absolute emissions and per capita emissions. So we have a responsibility here, and our sector in the US really has a responsibility to try to tackle and ratchet down these emissions. Within the US, we're about 10% of overall emissions, but as you noted, we're a large contributor, the sector is a large contributor to GDP at about 18% of the nation's GDP. And in Massachusetts, the sector employs about 500,000 people. So it's a significant employer and also one of the largest real estate holders. So what does all of that mean? It means that the sector, as you noted, has a significant impact on climate change. It's contributing. But it's also the only sector that has a mission to do no harm and a mandate to heal. And so, and because it's a huge economic engine, it means that when the healthcare sector chooses to take on an issue like climate change or work really within its own system to mitigate its own effects on climate change, that's not having an impact only within the 4 walls of those facilities. That impact is felt in the communities where they are anchor institutions. It's also felt in markets because it can really transform markets. It can shift the way we think about it. And then I think most notably, as Dr. Bernstein pointed out, healthcare is well positioned to tell the health story of climate change, which resonates more than strict GHG emission reductions does.
So you're saying that the healthcare industry, it's doing no harm, and it has a mission to help people, and it needs to pivot now to healing and equity as part of its approach, and climate, really addressing climate change is part of that. You've been seeing a number of hospitals making commitments on this front.
That's correct. So there are a number of hospitals that have been doing a lot of important climate and efficiency related work for a number of years. Even within Massachusetts, most of the hospitals that Healthcare Without Harm has worked with, all of the hospitals, have benefited from those nation-leading energy efficiency programs that Michelle mentioned. They have been thinking about ways to reduce their carbon footprint. So actually 22 hospitals in the greater Boston area lead the nation in GHG emission reductions. One of those facilities is Boston Medical Center. So I will leave it to Kate to speak to all the wonderful ways that BMC is really leading by example and doing so as a safety net hospital that is serving a very vulnerable population. But the long and short of it is hospitals really are working on vulnerability and resilience, climate mitigation and adaptation. And I think, you know, to Ari's point in trying to make it local, one example from the last week is not local, but it's a good example, is Kaiser Permanente announced last week that they had actually achieved carbon neutrality. Mass General Brigham system will actually be carbon net positive within the next 5 years. And then, as I said, I'm not going to steal the thunder from BMC. I'll leave it to Kate to tell you about the excellent things that are happening there. But it's worth noting that, as you said, Linda, the hospital sector, the healthcare sector is really recognizing that significant strides need to be made if we're going to have a chance of trying to beat back the challenges posed by climate change. And I think coming out of the last 6 months, hospitals are also recognizing that we would we will not succeed in achieving community resilience or climate resilience if we don't learn the hardest lesson that the pandemic taught us. And there's just simply no addressing climate change without also addressing health and environmental disparities that are disproportionately and have for a long time disproportionately burdened low-income communities and communities of color. So systems are recognizing this. They are recognizing that they have a role to play as anchor institutions in some of these vulnerable communities that are most vulnerable to the effects of climate change. And they're beginning to think about how to do even more to achieve a resilient healthcare system that is also climate resilient.
Great, thank you, Eugenia. Kate, Eugenia gave us about the best transition that we could hope for. So you run a private, not-for-profit, you have 514 bed academic medical center. You have a community-based focus. You have 5,700 employees, 760 physicians. You're big. What is it that you're doing? How have you been? Tell us a story about how you've been leading on this issue.
I thank you, and thank you, Eugenia, for all the kind words. I'm really honored to be here today because I think I can tell a story that if Boston Medical Center can do this, I think every hospital in the country can do it, and certainly many, many other employers. So we came to our sustainability journey the way we come to many things at BMC, which is, how can we make this budget work? And so for us, really, our sustainability work was rooted in cost savings, and we were able to, through the work that we've done in energy resilience, provided $5.5 million of annual savings every year, money we don't spend on energy that we can spend on patient care, which is for us absolutely critical. We remain on track to become carbon neutral. We were 96% of the way there pre-COVID. We actually had to increase the number of air exchanges and do some renovations to create surge space. So but carbon neutrality is still a goal for us for 2021. We did not get there we won't get there this year, which was our original goal. And changes that actually happened because of COVID, I think are going to propel that forward. So things like telehealth, so people aren't driving their cars or taking buses to come for clinic visits that could be handled electronically or over the phone. The most efficient from an energy conservation standpoint square foot is the one you don't build. So the fact that we don't need these large clinical buildings might really help us. And I think Kaiser has led the way for the whole country on that. So I would say first thing is cost savings. The second thing I want to say is creativity. There's so much pent up demand in our workforce because we recognize the health effects that Ari spoke of, that people really want to do something that will help leave the world a better place, make it easier for their patients to simply breathe. And so the creativity of our teams shows up in lots of different ways. We recycle 32% of our downstream waste. We built an energy and heat, the electricity and heat from our organization is provided by a cogen plant, which is the size of a trailer that sits on one of our roofs that saves us $1.5 million a year in energy costs. And it also has the ability to island us, so that if there was a superstorm Sandy or some event that affected Boston, which we know is just a matter of time, we could safely run our hospital with energy and heat and all the things that our patients need, and provide those supports to Boston EMS and Boston Department of Public Health, so we could support the communities that are most apt to be affected by a large organization, by a large climate disaster, and particularly our patients who would be more impacted by that as well. The third point is partnership. We don't do this alone. We do this in partnership with Veolia, with Eversource, with the state of Massachusetts that gave us a grant for the cogen facility. And I think Eugenia mentioned the capital assets. We were able to do some campus redesign that allowed us to do much of this energy upgrades that we did, and that was funded through green bonds. I kind of joke that BMC is a better bet for climate change than we are as a healthcare provider from a financial standpoint. But I think it spoke to the synergy and interest and passion of the private sector in making the world a safer and a better place to live, which I think Mindy can talk about in a moment. And then finally, the last point, and I'll end with this, is the employees who work at Boston Medical Center are very proud of this work. It is a huge employee engagement tool. For us, kind of the visual representation of that is that there's a farm on our rooftop that provides not only some greening for and cooling for our power plant, but also 5,000 pounds of food each summer for our patient trays, for our food pantry, and the leftovers we share with our employees. So it really has just been a wonderful way to kind of organize our campus around doing great good for the largest number of people we can while reducing our overall costs and environmental footprint. So we're very proud of this work and very proud to partner with people. And I'll leave it there, but happy to take any questions.
Thanks. And so there was such a really great overview of just sort of the number of different ways. And when I introduced you, I started with numbers because one of the most impressive things about what you're doing is that you're really measuring every aspect. You're measuring the impact, and you're showing that it not only makes smart business sense, but because it's saving your company money, but you're actually really keeping track of, is what we're doing actually having an impact? And the fact that you are setting the tone by being so data specific really helps all of the other aspects of, one, your collaboration across the state with other organizations, and also the engagement of your employees, so that they have the story to tell as well. Because when we talked about the stakeholder influence with Michelle, people want to be part of this. There are a lot of people really want to help be part of the solution, and the way that you're structuring it is really making it easier for your employees to be engaged.
Thank you. And I would just leave people, if Boston Medical Center can figure this out, everyone can, and everyone should.
Great. Well, somebody who can help us with that, thank you, Kate, is Elizabeth. Elizabeth, you run a 122-year-old advocacy organization that has been pushing Massachusetts to lead on this for a long time. Can you talk to us about this environment and economy debate? So Kate was actually making the case that it makes great business sense to be doing this, but a lot of people in sort of the larger conversation is the conversation, well, we need to protect the economy, and that's often at the expense of the environment. Can you talk to us about this hopefully false choice?
Definitely, and thank you, Linda. And congratulations, Biogen. We're really proud of your record so far. I mean, carbon neutral since 2014, and of these recent commitments is a great model for other businesses and for the state itself. You're right, Linda. We do believe that a strong economy and a thriving environment aren't mutually exclusive, but they're actually mutually reinforcing. And so many leading businesses really get this. It always surprises people to hear that half of the Fortune 500 that are headquartered in Massachusetts have climate and energy goals that either meet or exceed the state's own goal. For example, ELM has a corporate council of 25 leading businesses, including Biogen, who join us in advocating for the state to continue to raise the bar. Biogen, just to brag on you for a minute, I mean, you signed your name this year alone in support of more offshore wind, the Transportation and Climate Initiative, so curbing tailpipe emissions, and strengthening environmental justice protections. And Kate, you and your team also weighed in support of the environmental justice provisions this session too, so thank you. Leading companies get that there are these state policy levers that we should pull, and a really strong business case and human health case for doing so. You heard Dr. Bernstein and the Biogen team talk about how the human health benefits of eliminating tailpipe emissions would actually pay back even if there was no climate crisis. I mean, these are things that we should do just because they're good for people's bodies. And businesses also get that clean energy could be the future of our tax base. Today, there are twice as many clean energy jobs in Massachusetts as there are coal jobs in the entire nation. And it could be just the beginning.
Sorry, Elizabeth, can you just repeat one aspect? Because one of the things in the election has been the discussion about saving these coal jobs, and just sort of the understanding of how big the alternative is just incredibly exciting. I feel like enough people in Massachusetts don't appreciate that.
Yeah, Linda, I grew up in West Virginia, and I love that landscape, and I'm certainly really familiar with the coal industry, but there's only about 60,000 coal jobs left in the whole country. And there's over 100, well, pre-recession anyway, over 120,000 clean energy jobs in Massachusetts. And with more ambitious climate goals and stronger policy, I mean, clean energy could be the workhorse of our economic recovery.
Great.
So if we're proactive, just to kind of put a finer point on that, offshore wind could grow to be over $100 billion industry in New England. And once up and running, offshore wind will shut down almost every old fossil fuel power plant, significantly improving air quality, particularly in these communities that have been hardest hit. So I thought I would just close with a little call to action. I run an advocacy organization after all, and right now, state legislators are crafting the final climate bill that will be sent to Governor Baker's desk for signing this fall. And we need that bill to be a strategic, data-driven pathway to build a net zero economy before 2050. Massachusetts has the opportunity to lead the nation, and the scale of our response simply must match the urgency and the scale of this crisis. So thanks for having me.
So there are three members of the Senate and House that are debating what to include in this legislative climate package. So you would encourage people to call and reach out to those three people?
That's right. The Senate and the House Conference Committee members are meeting this fall to reconcile the Senate's bill and the House's bill, both of which were quite ambitious, had some really great elements. And Secretary Theoharides, that's going to be coming to your boss for signing sometime this fall. So yes, reaching out to your senators and state representatives would be a great action.
Great. Thank you. Thank you, Elizabeth. Mindy, how has climate science changed and what's needed now? So we've been talking about sort of the specific health aspect. Can you talk to us about the larger science aspect? What do we need to do for our new targets?
So one thing we know now, and we know it either through using our eyes to look at what's going on in the western part of the country, otherwise known as California, Oregon, and Washington State, where I'll come back to giving scientific statistics, but we are now living and seeing the impacts of climate every day. Science is telling us that we need to get to a 1.5 degree future. Now, people on my street, my neighborhood, don't know what a 1.5 degree future means, but it means the science is clear that we have to work as a global community. Remember, on climate change, what happens in Boston impacts Beijing, what happens in Rio de Janeiro impacts Brazil. I mean, these aren't problems like manufacturing facilities that are polluting certain kind of toxics that only hurt one community. What we know is climate change, everything we do in Boston hurts other places. So we've got a global problem. We've got a global imperative saying we need to bring our emissions down to 1.5 degrees, and we're not yet on track to do that. The Paris Agreement has given us a North Star. How do we work together as a global community to reach that? And what we've learned from COVID is when we have a shock to the system so severe, the impacts on our humanity, on our people, on our health, and our economy are greater than we're able to deal with. Climate change is about to deliver those same kind of shocks. It already is in so many ways. Science has told us it is clear beyond a shadow of a doubt. When I listened to the news, even this morning, Al Roker, the weather forecaster, said, not only are these forest fires and storms weather impacts, they're climate impacts. And he talked about the multi-billion dollars for each storm and what they're doing to our economy. So the clear message is we need to listen to the scientists. We need to understand that timing matters. We need to move at a pace and a scale different than absolutely anything we've done. We can mitigate the problem of climate change, not stop it and solve it. And the longer we wait to do so, the more it impacts our lives, our kids, our communities, and our economies. So without question, science has told us the time to act is now, and at a scale and a pace far greater than anything we've seen.
So I want to say one more aspect is that we're making a lot of parallels between COVID and the climate crisis, just especially in terms of how prepared we were. What lessons are you hoping people take from the pandemic that can be applied to the environment?
Well, I'm hoping, and I'm seeing a good deal of it, that people realize that kind of global systemic shock is not something we could afford to have again. And I was worried. I mean, we're in advocacy groups that works with global large companies, publicly traded companies, and 195 of the world's largest investors to make the case that climate risk is as much an economic risk as inflation risk or currency risk or trade risk. And the interesting thing, Linda, is not only is Biogen a great leader, and we welcomed them recently into our policy network, But hundreds and thousands of companies need to act and are starting to act. And while there was a slowdown, I'd say for about a month or two after COVID started, the energy, the movement, the pace is back. We're seeing hundreds and hundreds of companies act, from Apple to Biogen to Walmart, where they're setting goals, ambitious goals about getting to a reduction of their greenhouse gas emissions, setting goals of being there by 2040 to being net zero. They're changing their electricity and what kind of energy. They're changing their vehicles to be electric vehicles. They're changing their buildings. And what's come of that is a few things. One is customers want to shop at companies that have a values-driven mentality as well as a short-term earnings mentality. And young people want to work for those companies. Kate talked about how proud people feel at BMC, about being part of an institution that is bigger than one mission. Now, their mission is great in and of itself, exemplary care without exception for people, and they do such a beautiful job. But adding this has been a great addition to employee satisfaction, and we're seeing that at every company we work with. And further, the investors we work with are seeing climate risk as an economic risk. They don't want to be invested in companies that are ignoring that risk, and they believe if they invest in companies that are looking at the risk, they will do better as investors, and those companies will do better. So the pace is clear. We're seeing more and more of it. Enough? Not enough, Linda. We need to do more. But we're on the right path. And we don't solve this problem of climate change as just an environmental community or a public health community. We need all of the players involved. We need people with R's and D's after their name. This is about our kids' lives. So we need to act and act quickly.
Thanks, Mindy. Secretary, thank you so much for joining us. And this has been such a great panel because we've been able to take sort of, we keep zooming in and out, and you're taking the perspective of the entire state from your perch and the actions that we're taking. We've talked a lot about, Massachusetts being a leader. What progress has Massachusetts actually made on climate and health, particularly with vulnerable communities? What can we actually say that we've done?
Well, thank you, Linda, and thank you to the Globe and Biogen for this panel. It's great to be with this group and so many others. Here in Massachusetts, Governor Baker and Lieutenant Governor Polito are committed to strong, aggressive action on climate change. And you see that in the governor's commitment to a net zero goal for 2050. It puts us on the right side of the science there and shows the urgency of solutions to reducing greenhouse gas. And that has been, for us, using the science as the driver of solutions and of policy choices has been critical. And so when the science was updated, we started looking right away at what new standards we had to choose. But for a state, we're sort of in the middle of the scales of action on climate change. There's global action that's needed, there's national leadership and strong federal regulatory standards that are needed. There's state action, and then there's local action. And I often think about how we have a number of different roles here. We have to lead on climate change and show other states and countries and our cities and towns practical solutions, cost-effective solutions, things that stimulate our economies, solutions that work for all communities. So we're serving overburdened and underserved communities as we're trying to do through the Transportation Climate Initiative. We also have a role in innovation and continuing to push on clean energy and showing how clean energy can be done and continue to stimulate our economy. But I think one of the things that we have a real opportunity for at the state scale is working with our cities and towns to deploy climate change solutions in an equitable way, in a cost-effective way, and in a way that allows communities not just to think about the impacts of climate change we're dealing with and reducing their own impact on climate change by reducing emissions, but also on just creating the communities of the future that they want to see. And it's a chance for real vision, for local leadership and innovation, and to create communities with walkable streets without urban heat islands, with access to healthcare and access to safe and clean transportation options. And I think as we're all grappling with this pandemic, something we've seen is a continued push from local leaders in building the communities of tomorrow, taking care of their residents, and ensuring that as we're doing things to recover from the pandemic, we're doing them in a way that makes sense for the climate, and so that we can take care of our home. Because at the end of the day, that's really what we're doing here. If we can't take care of our health if we're not taking care of our home.
Great. And one of the things that I've appreciated about your leadership on this front is really your embracing of collaboration, and that this isn't, companies aren't competing with each other. They're trying to sort of keep up with each other. And there's no, there's a real sense of sharing of what's working for one company and how other companies can also adopt it. What have you been doing to foster this collaboration and bringing together leaders from across different sectors? We've been talking a lot about specifically healthcare and life sciences and what's being done there, but how are you able to do that?
We've brought together through the state a number of different groups, whether it's been on resiliency or through our implementation advisory council of our Global Warming Solutions Act. We bring in different leaders from the energy sector, from the clean energy sector, from utilities, from healthcare, certainly from many of the groups represented here, to help us think about policy solutions and innovative options for moving forward. And I think that's one of the things that is so important in government, is to realize we often don't have all of the answers, and bringing together many different voices to help chase those answers. And something that many of the panelists have spoken to, Massachusetts is really good at innovation. And we have, excellent universities, excellent nonprofits working on these excellent business sector minds working on these solutions. And so if there ever was a place to pull together people and different groups, this is it. And so I feel like we have gained so much as a state from this leadership across our state, and being able to bring those voices into the conversation has meant a lot. And I think you've seen it certainly through the Transportation Climate Initiative, where many of the groups here today have weighed in on that, brought their stakeholders to the table on that, and many businesses have as well. And they've made it a stronger program with a diversity of voices and interests, just joining together to really let everyone know this is not just a climate change thing. This is something that will stimulate our economy, help environmental justice communities deal with air pollution and respiratory illnesses, and really improve the livability of our communities across the region.
This actually brings in I'm switching over to the Q&A, and I have some questions that our audience has submitted. Gabrielle McDermott asked a really relevant question here. He said, how do we lead those around us, including our local and state governments, to better address these issues? I'm in a state that's not as progressive as Massachusetts. I'm very sorry. You're welcome to move here. What advice do you have for impacting the system? That's open to whomever.
So I think that it's an excellent question. And I think that, one thing to consider is the reason why we are talking today about the health impacts of climate is because, as we noted, everybody is affected by health. And that is a very compelling argument for why we need to move on climate. There's obviously the economic arguments that Elizabeth spoke to, and the economic benefits that come with building an industry from the ground up and really anchoring it in a place. I think it's worth noting there are some states out there that are certainly not as progressive as Massachusetts, but who are doing really excellent things with renewable energy. There's a whole lot of wind in Texas and in some of our central and western states, and that is arguably not because climate change was the argument that won the day. It was the economics. It made sense. So I think the challenge that all of us as advocates face is sometimes you do have to meet people where they are and find that common language and then push them to go further. And I think on the issue of clean energy and climate, there are a number of different levers that we can pull that are compelling to folks that don't necessarily begin and end with, we have to reduce greenhouse gas emissions.
Thank you. I have another question here. It says, I think I read somewhere that the changing climate contributes to the viruses that we may or may not see in the future. Michelle, can you speak to that one?
Yeah, I mean, people are stipulating that there are some correlation maybe between the climate changes and the emergence of new viruses and pandemia, the impact on the Arctic, Antarctic, and the melting, and the resurgence of potential, viruses and bacteria that may affect humanity. But this has to be better documented. Maybe my colleague from Harvard can say a few words.
Ari, do you have thoughts on this?
Sure. I think there's a very important connection, which we've all been talking about, which is viruses like coronaviruses may be more likely to move into people because of deforestation. Chopping down forests takes away the home. Katie was talking about the homes. We need to protect homes. We need to protect the homes of species on Earth that, like bats, that can carry viruses. We've been working with a group of colleagues, economists, people who are specialists in ecology, infectious diseases, climate, and we looked at what it would cost to prevent deforestation in the places where, for instance, bats are losing habitat and maybe coming into more contact with people because they're looking for food, they're looking for shelter. So deforestation is a big part of that. We looked at total cost. It was about $20 billion a year to cut the deforestation by half in the hotspots for emerging infections. Now you think about that, that sounds like a lot of money until you realize we spent $10 trillion on this one disease. So if you spent the $20 billion every year for a decade, you only spend about 1% or 2%. And of course, preventing chopping down of trees, particularly in tropical areas, prevents a major source of carbon emissions. It prevents fires. So a lot of these forests are being cleared by fires, and that smoke isn't just a problem for the people living in the countries where it happens. It matters around the world. And so again, and of course, we see in those countries as well as in the United States, these effects are felt most heavily on the most disadvantaged. So it's a really important connection for people in the United States to realize that our actions about where we procure goods, so why is deforestation happening? In many cases, it's because we consumers are demanding it through companies, and companies have a choice about whether they will engage in practices that promote deforestation. And consumers should be asking questions of companies. And I think that's why it's terrific to have organizations like Mindy's represented here, to have Biogen, to show that the corporate sector, the private sector is increasingly recognizing this potential. And the fact of the matter is that by doing that, we drive the change that's going to prevent climate change. It may forestall the next pandemic, and it's going to promote a healthier world.
That ties in, thank you, Ari. That ties into the next question, which is for you, Kate. It says hospitals and healthcare facilities use a lot of plastics and dispose of huge amounts of non-biodegradable materials. You've talked about this a little bit, but this attendee would like to know what's being done to reduce this waste.
Yeah, I think Eugenia said it much more gently than this, but hospitals are incredible energy hogs. We're open 24/7, lights are blinking, and we triple wrap everything. And so we had actually an initiative in our operating rooms to try to recycle the blue paper. Part of it is creating that wraps every kit that and that's gotten worse with COVID because we've had to sort of double and triple wrap everything before the patients need, and everyone's wearing much more protective gear, all of which by definition is disposable. I think we need some of that Massachusetts innovation that the Secretary spoke about to really get on top of ways to protect ourselves and protect our healthcare workers without destroying the environment. I think the answers are out there, but we need to create some businesses around that because I think what we saw in the early days of COVID was the disruption to the global supply chain that actually endangered lives across the world. So I think finding those solutions and doing them through an energy lens, because we have to think that in the midst of COVID, all you can think about is please nobody get sick, nobody get this at work. But in fact, we realized that all the things that led up to this are really part of it's a pretty small world when you step back and look at it, particularly in this context. And I think it's getting smaller and sadly hotter every day. So we've got to step back and figure this out.
Great, thank you. An attendee, Ananya Jain, had a question. How can we encourage society and citizens to move away from recycling and focus on reuse and use less? The use of plastic cloths, even masks in abundance, is adding to the waste. Eventually managing the waste, sort of that aspect of it. Elizabeth, do you want to talk about this one?
a good question. I mean, it's something that I think about a lot. I'd actually be curious to hear what other panelists have to say.
Mindy, your secretary, do you want to take?
Sure. Well, first of all, we know it can be done. If we look at Europe, where there's a different ethic of we don't use things, throw them away, use things, throw them away, but rather they've been reusing bags, driving smaller cars, not having the kind of mentality that we have in the United States, which we were all brought up thinking 4 cars are better than 1 and 6 TVs are better than 2. So I do think there's a lot of education involved at the lowest levels where we don't value stuff and things and more about it and just get a new refrigerator and think we'll recycle it, but rather to use things longer, better, hold on to the quality. Now that could be done in a lot of ways. Education is certainly an important part, and I think we all need to model that education. But there also could be incentives in the marketplace on creating materials that last longer and materials, and not having the incentives for recycling, but having incentives for different kind of materials that last longer, that use different chemicals and products. So we're not creating the stuff in the first place. It's a long process, but I think that's what we've all got to be thinking about and doing.
There's some interesting behavioral science opportunities there. Secretary, this next question is for you. Where are state business associations on these issues? Are they joining in the fight against climate change the way the individual businesses that we've talked about today are?
So I think it's, it's a mixed bag of different groups in terms of their knowledge of these issues and how much support they've lent to them. But we've seen a lot of support for both our net zero goals and the Transportation Climate Initiative, as well as our resiliency programs and our green communities programs from many of the business groups in the state, whether it's the chambers of commerce or some of the business associations. And so I think there is a lot of, there's both interest from their members in these types of programs and in climate change as a whole, and also I think a recognition from many of the groups that Massachusetts, being a leader on climate, positions the state to take advantage not only of the economic opportunities that come with that type of innovation, but also the opportunities to build better communities and help everyone across the state. So generally, very supportive, and we always look to engage those types of groups in this conversation.
Linda, if I could just jump in, I just want to add one thing to what the Secretary said. I agree with everything. But reaching back to the previous question, I mean, I think part of the challenge is also at a certain point we have to kind of draw a line in the sand and say we're not going to do any more of the bad things that have gotten us to this point. We have to prioritize making this shift. I think that is why it's so important and so significant that Biogen has made the very public commitment that it's made, and that it is going from every level, from top to bottom throughout the organization. It's affecting markets. The groups that Mindy works with, the organizations and businesses, are doing the same thing. You know, Kate is part of a hospital system that we've said is leading by example. There are many others. I think that we're going to have to pivot very quickly. And this maybe is a takeaway from COVID, that we have to just start doing the things that are hard, but are going to have an impact. And we just have to kind of shift our dollars and our policies and our commitments in that direction, or we're just never going to get to where we need to be. And the last thing I'll say is, while we're doing that, we need to make sure that we're anchoring those commitments and those investment and that work in ensuring that the folks who have until now been left behind are moving with us. So that is why it's so important that we think about environmental justice protections, and we think about prioritizing vulnerable communities from a health perspective, equity, and climate. Because again, we just will not achieve a resilient place if we fail to do so.
I think that's a point really worth picking up on, Eugenia. I think sometimes we assume that if we're working on climate change or we're working on environmental quality or air pollution issues, that we are delivering benefits to environmental justice communities, to communities that have historically been overburdened by these issues. But unless we're consciously designing programs with those things in mind, we're not picking up those pieces. And so this is something we've been thinking about a lot. We have a new environmental justice program that we're working on building out, but it can't just be, this is happening because we're doing programs to address these issues. It has to be deliberate and thoughtful, and it requires deep engagement with those communities. And I think it can't be, I think it can't be said enough.
I'm going to give the final question, because I've gone over, because we got so many great questions, but to a high school senior named Gabrielle McDermott, who had decided that this was a really important part of his remote learning, was this panel. And his question is this shift primarily independent or societal? And what should he focus on as a high school senior?
So I'm going to jump in, and I'm sure all my colleagues will, but one is the future is his. And I think so much of this problem is being led by the youth, and we need to applaud that and back them up. As much as individual companies and individual hospitals and individuals like each of us on the panel and companies like Biogen are doing their share in moving, we need public policy. We need a level playing field that says everybody plays by the same rules. And we heard about that at the state level. We need it at the federal level. And so thinking about how to change policy that applies to everybody. If we just think right now, trillions of dollars with a T are coming into the budget, stimulus packages, infrastructure to get us out of COVID. We could either build out in a way that is about a fair, equitable, and clean future, or we could go back to the way we've been that has been harming us. And I think students standing up for public policy, standing up with the companies they buy from, are part of our future. So I hope your high school student, and I didn't catch his name, goes forth, continues to lead. Go for it, Gabrielle.
Great. And I will invite, if I may, Linda, I will invite Gabrielle to think about the following question. Can we be economically successful? Okay, the way this world of mondialization try to foster with industrialization and so on, while doing what we have to do for the environment. Can we have that in our arsenal of performing well, but the how should be also as important than what we deliver? And I believe yes, but this calls for leadership. And the last word as an advice to him is that if we don't set the right metrics, and if we don't measure progress versus those metrics that we set, we don't know where we go. So this is very important, and this has to be from a scorecard of a company to a government, to an electoral debate, and to Davos setting, and to eventually a new order of mondialization that is much more focused on health and climate than industrialization.
Wonderful. Thank you. Thank you all so much. This has been a really enlightening conversation. We had a few thousand people join us for this. And I want to thank you all for your leadership, not only what you're doing on your individual organizations and how you're measuring it and within your industries and within the science as a whole, but how you're also sharing it. The work that you're doing is something that we are all benefiting from. So thank you for taking the initiative and for taking the time to share what you've learned and your best practices, so that all of us can be a little bit more inspired to be more thoughtful in all of this. So thank you all so much. This has been a lot of fun for me. I enjoyed this. Thank you.
Thank you all.
Thank you.
Thank you.